For some, it's gradual. For others, you start to notice those clumps collecting in your shower drain. We're talking about hair loss, and we want to welcome Tierra Rivers, certified hair loss specialist at Carolina Hair Restoration Center, with more on treatments during National Hair Loss Awareness Month. It's good to have you.
Thank you for having me.
And I think we're talking about something that just about everybody experiences. So, of the clients you see, how many would you say are men versus women?
Well, I actually see a lot of female clients as well as males. I think that's like the majority of folks that I actually see are females. Sometimes with males, they could be like, oh, I'll just shave my head bald, or may not look into hair replacement or education on hair loss as much as women do, because overall it affects their self-esteem and women are really concerned about that, so that's really big.
They say that, a woman's hair is her crowning glory,
yes,
right? And that's how we feel. And then when we see others with just these flowing, luscious locks, you have a little hair envy, because, you want to have that. You want to at least have the option.
Right.
Men do have a little bit easier, I will say.
Right.
Sorry, men, but, you can shave it off if you so desired. But that aside, when we're talking about what hair loss actually is, we're not necessarily talking about just the few hairs that we pull out when we brush it.
Right.
So how do you define hair loss?
Well, we shed about 50 to 100 strands of hair on a day-to-day basis, but when you start seeing clumps of hair, just like you're referring to the shower, or when you comb your hair, or you start receiving or start seeing, the hair receding around the receding lines. I see a lot of clients that have thinning, around the hairline or the baldness, sometimes in patches, which is more of the...
Is there a test to see if you suffer from hair loss?
Well, yes. We actually, at Carolina Hair Restoration Center, we perform a scalp analysis where we look into the scalp and the hair, just seeing the situation that's going on with the hair and the hair follicles, to see whether or not it's damaged, whether it's scarring or non-scarring alopecia. And at that point, we kind of tell the client what services that we can render to them to either A, help them to regain their hair by our treatments, or we may offer non-surgical hair replacement, which is basically adding hair to the area that's basically bald or thin.
Yeah, I can't wait to hear more about the treatments that you offer, but what are some of the most common causes of hair loss?
Yes, so some of the major causes, or some of the causes of hair loss, would have to be hereditary. That's probably one of the biggest areas I've seen. Hereditary, along with stress. Folks have been under a lot of stress lately, as well as just in life in general. Medications, some folks that's on like high blood pressure medication, I see a lot of them. Women that may have had a child.
Yes, I've heard that as well.
Yes, postpartum, folks kind of lose their hair there.
It tends to grow back though, right? As the hormones sort of regulate, it starts to come back?
It's a case-by-case situation.
Okay.
Sometimes through treatment, the hair can be regenerated or strengthened and kind of grow back. And in some cases, it's more of severe. And so that's the purpose of just doing the scalp analysis.
And you were talking about treatment, so what would be a typical treatment for a woman?
Okay, well, we offer treatment, which is a series of hair shampoos that's performed by a certified hair loss specialist, and what that does is it strengthens the hair follicles to gain its strength and help to stimulate some hair growth.
I know, because various hairstyles, and I myself have worn extensions in my past, and those tend to put a lot of stress on your hair and your scalp. You only hope that it does grow back. Well, I so appreciate, Tierra, you sharing your story with us.
Thank you.
So we're going to put up on the screen for more information, anybody who'd like to come and visit you and to have an analysis. So thank you again for joining us.
Thank you for having me.
We're back after this.